Clinical protocols for obesity traditionally prioritize the reduction of excess weight, but this overlooks the internal damage accumulating at a cellular level. This American Diabetes Association diagram illustrates a burning stopwatch at the center of the brain, heart, liver, and kidneys. It represents a shift in clinical understanding. Obesity is a state where biological aging is accelerated across all major organ systems. Rather than a simple dysfunction of adipose tissue, we are looking at a condition characterized by systemic biological decline. GLP-1 receptor agonists, specifically semaglutide, have emerged as agents that may interrupt this accelerated aging process. In this module, we will evaluate the use of epigenetic clocks to measure this effect, map the underlying molecular mechanisms, and define a framework for neurological prevention. While weight management remains a primary goal, the most significant question is whether semaglutide can shift biology's time. Chronological age follows the calendar, but biological age tracks the physiological wear and tear on a patient's cells. Standard time rarely reflects this internal state. To measure this wear, researchers utilize second-generation epigenetic clocks. These predictive models analyze DNA methylation and proteomics to estimate a patient's risk of functional decline and morbidity from their molecular profile. When an intervention modifies these chemical markers, the biological ticker slows down relative to standard time. The critical question for clinicians is whether a drug designed for glycemic control and weight loss can decelerate the markers on these epigenetic clocks. If these clocks can be slowed, then obesity treatments serve as longevity interventions. Proteomic data from the SELECT, Step 1, and Step 2 trials provides an empirical look at this effect. Analyses presented at the ADA suggest that treating obesity with semaglutide can slow biological acceleration at a systemic level. This chart maps the results across cohorts. In the SELECT trial, semaglutide reduced multi-organ biological age by 5.21 alpha, increasing respiration and reducing reactive oxygen species. There is also the loss of proteostasis. GLP-1 enhances autophagy through the AMPK and mTOR pathways to clear misfolded proteins from the cell. Finally, semaglutide addresses inflammaging. Clinical trials show a systemic suppression of inflammatory markers like hsCRP, interleukin-6, and TNF-alpha. Ultimately, semaglutide orchestrates a coordinated cellular rescue by engaging the molecular pathways that govern aging and survival. This cellular rescue mission creates a translational paradox. GLP-1s show significant neuroprotection in preclinical models by suppressing neuroinflammation. However, the Phase 3 EVOKE trials found no clinical benefit for patients with established Alzheimer's disease. Pharmacokinetics explains this gap. The drug's concentration in cerebrospinal fluid is only about 0.4% of its plasma concentration, resulting in limited direct access to the brain. This defines the therapeutic window. Semaglutide succeeds upstream by resolving peripheral metabolic dysfunction and chronic inflammatory signals before they drive neurodegeneration. But it cannot reverse established amyloid-driven pathology, which explains the EVOKE outcome. The neuroprotective value of GLP-1s is found in prevention, resolving metabolic risk factors before irreversible neurological damage occurs. This data expands the focus for clinical practice, moving beyond weight management and into the territory of biological age. We can summarize this masterclass with 5 clinical takeaways. 1. Reframe obesity. Adiposity acts as a driver for systemic biological aging across organ systems. 2. Evaluate the gerotherapeutic potential of GLP-1s to slow multi-organ biological clocks. 3. Address the systemic mechanisms involving autophagy and mitochondrial health. 4. Target the preventative window for neurological health. And 5. Shift the focus from isolated weight loss outcomes toward optimizing long-term health span. Optimizing the standard of care involves managing a patient's biological timeline to improve their long-term health span.